So when you think about modern cancer treatment, one word really comes to mind: precision. I mean, we're talking about blasting tumors with these incredibly powerful radiation beams. And a lot of the time, you've got just millimeters, literally millimeters, between that cancer and some really important healthy organs. Right away, you can see the huge challenge here. I mean, really think about that for a second. The beam is invisible. The tumor is deep inside the body. And getting this wrong? Well, that's just not an option. So the big question is, how in the world do doctors map out this perfect attack plan before a single bit of radiation is ever used? Well, the answer is, it's a really incredible piece of tech.
It's called a radiographic simulator. And honestly, the best way to think about it is like a full-on dress rehearsal for the actual treatment. It's like a stand-in, maybe even a stunt double for the real therapy machine. This lets the medical team plan everything out. The aiming, the positioning, they can practice the whole thing without ever exposing the patient to that high-energy treatment radiation.
And this is really the core of it all. What you're seeing here is the textbook definition that's our guide. The most important part, that phrase right there, it duplicates a radiation treatment unit in terms of its geometric, mechanical, and optical properties. What does that mean in plain English? It means it's a perfect copy. And that right there is what makes it so revolutionary. So what does being a perfect copy actually look like? Well, this gives you an idea. The simulator can rotate to the exact same angles as the real machine. It can shape its beam to the exact same size. It even has the same positioning lasers. It copies absolutely everything except for that powerful treatment-level radiation. And because of that, you know that the plan you make here is going to work perfectly when it's time for the real deal.
Okay, so you might be thinking, why not just use the actual treatment machine to take pictures and do the planning? I mean, it seems logical, right? But it turns out there are 4 really big reasons why that's a bad idea, and why a dedicated simulator became, well, absolutely essential.
Yeah, before these simulators existed, planning was, let's just say it was a huge headache. You were basically stuck trying to work with mismatched x-rays or these really low-quality, fuzzy images from the therapy machine itself. And you were doing all this while the clock was ticking, using up precious treatment time. The simulator completely changed the game. You go from basically guesswork to pinpoint precision, and you get to solve problems before they even have a chance to become problems. All right, let's really break down those 4 critical points. First up, the therapy machines themselves. They're built to treat, not to take amazing pictures, so the images you get from them are kind of blurry, which isn't great for aiming. Second, trying to do all this planning in the actual treatment room, it's just a massive waste of time. Third, you can run into all sorts of unexpected issues, Like maybe a patient just can't comfortably hold a certain position. And last but not least, a regular standard x-ray machine, it just can't copy the exact geometry of the treatment beam. So the simulator, it was designed to fix every single one of these problems. That's why it was such a game changer.
But here's the thing, the simulator's job didn't stop at just aiming the beam. Its role has gotten way bigger over time. Now, it's pretty much the central hub, the command center, for gathering all the data you need to create a truly personalized treatment plan. So let's dig into what that actually means. So during this dress rehearsal, the team is collecting a ton of information. They're getting a clear look at the internal organs, they're mapping out the exact contours of the patient's body, they're even creating custom molds and devices to make sure the patient can stay perfectly still. And this is also where they figure out if they need special tools, like something called a compensator or a bolus. Think of those as custom-made filters that shape the radiation beam so it perfectly hits the tumor at the right depth and shape. It really turns the whole simulation process into this data-gathering powerhouse. It's all about making sure every single part of the treatment is tailored specifically to that one person. And this quote from our source material just nails the practical benefit of all this. It says, unforeseen problems can be solved during simulation, thus conserving time within the treatment room. And that's so true. Finding a problem during this planning stage, no big deal. You just solve it. Finding that same problem when you're in the actual treatment room with a line of other patients waiting, that's a huge, costly delay. So yeah, the simulator saves so much of that incredibly precious time. So what's the big takeaway here? What's the impact? Well, the invention of the radiographic simulator didn't just improve things a little bit. It completely changed the standard of care in radiation therapy. It was a massive shift, a paradigm shift, from close enough to absolutely perfect accuracy. And that's really the bottom line.
Every single piece of data, every measurement, every angle that gets checked during the simulation, it all comes together to create this hyper-accurate, totally personalized battle plan against cancer. It's all designed to make sure that the radiation hits its target with maximum force, while doing everything possible to protect the healthy tissue right next to it.
It's amazing, right? The simulator lets us perfect the plan before the fight even really begins. It's just an incredible testament to how far we've come in medicine. And that leaves us with a really interesting question to chew on. If simulation has pretty much perfected the plan, what's the next big leap forward? What's the next frontier when it comes to personalizing cancer treatment even more?